I have been asked to discuss about the surgical robot is a very great achievement of the day this time in the contemporary world. And it has got multifold, huge amount of impact over the world during this time. And whether we should have it or is it too luxury for us. Health is a fundamental issue, as has been described by the WHO. I tried to find it out in the Bangladesh Constitution. It has not been reported like that. But it is a very important issue if you consider from the personal viewpoint, or everybody consider in his personal viewpoint, maybe he is a rich man or a poor man. In fact, traditional surgery is done by the surgeons. Surgeons require tools. The robots are only tools for surgery. Precision surgery can be done by robotic tool. Robots are not doing the surgery, but the humans are engaged in driving the robot for the proper work. The surgeon may use this tool when it is needed, but the people who are working in the developing countries, they can't buy it or afford to buy it because of the high cost. But if you consider, the cost is really not a matter. When we have introduced with the mobile phone, we thought that it is very expensive. But over the time it has been seen, every people have got a mobile phone in their possessions. And not only that, from the Alexander Graham Bell's type of telephonic equipment has been converted into iPhone 15, which is not yet available in the market, but there has been a huge demand for this phone from this country as well. So we understand the price is not really a barrier. So we must have robot. I was very fascinating about the photographic equipment. If you look into the primitive photographic equipment on the left side, and you will see the development, and finally I can tell you the Canon AE1, it was a very favorite photographic equipment which I bought with a huge expenditure. And I was loving to use it, understanding that there will not be much improvement on that. But I have found in short length of time, the photographic film has been eliminated. Nobody uses or know that photograph can be done by photosensitive films. It's not existing. So new SLR cameras are available. Even the iPhone with a lot of telephoto and other lenses are available. People are embracing it. So from this viewpoint, you can understand very easily the price is not the barrier. So what is surgical robot? My friends are here. They are familiar with surgical robots, but there are few other people, for them only. Let me tell you that robotic surgery is performed with a system of device which has got three important components. One is surgical arms. These are the arms which is loaded with the laparoscopic equipments. And the special camera which has got a 3D vision. And the surgical console, you can see the man who is operating, he is the surgeon. So he play in the console what he want to do. If he want to cut, if he want to do something, then he will be able to use the appropriate instrument which is preloaded on the device. Common question, who performed the robotic surgery? Certainly it is not the robot. It is the person who is sitting in the console. He will be driving the robot. So this is very simple to know. And what are the uses? Usually it is used by almost all different kind of surgeons, particularly more frequently by the urologist, gynecologist, cardiothoracic surgeons, and whatnot. Everywhere it is being used. We'll come to that later. Think about the Bangladesh government. Bangladesh government is absolutely very much concerned about the use of robot, and they had a publication. And we found that we sneak out that about 20 different sectors, they are using the robotic technology right at this time in this country. Maybe this is a poor country, but we are utilizing robot in 20 sectors, except the last one, 20th year, is the healthcare and service delivery. Unfortunately, we have not been able to establish a single robot in this country in any hospital. So that is the primary importance I should bring out here, that we should be motivated to convince our people that we should embrace it. What is the advantage of the robotic surgery? In fact, in 2016, there was a publication from Lancet expressing that the robotic surgery and open radical prostatectomy does not have any difference after 3 months. There is no remarkable difference. In terms of urinary function, in terms of sexual function, in terms of cancer control, all they are same. But nowadays, we have understood very clearly after some time, 2016 and this is 24, this has given a clear outline that it has reduced the blood loss. Usually the robotic surgery, since the intra-abdominal pressure remains higher, so it is very much possible to work in almost a bloodless field. And shorter hospital stay, this was also stated earlier, and a smaller scar. These are the advantages. More important to that, precision surgery is nowadays being possible in partial nephrectomy, in T3 prostate cancer, and in difficult situations, which can be done better by the robotic surgery than the open or conventional laparoscopic surgery. Following radical prostatectomy, we have asked to discuss these issues. Cancer control, urinary control, and the sexual function, there is no difference in traditional surgery and robotic-assisted radical prostatectomy. That's the current scenario. But in 5 years' time, the scenario will not be like that. The open operation remain like that, but the robotic technology will advance and will bring unlimited resources and possibilities. You see this one, that the huge demand by the colorectal surgeons, the cardiothoracic surgeons, the urologists, the oncologists, the gynecologists, general surgeons, pediatric surgeons, head and neck surgeons, they all need it. In fact, there are advantages I have already discussed, and disadvantages, high cost. And the lack of internet also very important. Good 5G internet is very much important. If you think about the cost of the robotic surgical system installation, you will be surprised to understand that it is not that much. Why I'm saying this? Because this is the country of 160 million people, and huge amount of resources are there beyond our knowledge. And this Da Vinci system, if we think about it, cost about $2.6 million. And if you can establish one system to any hospital, then all the specialty which I have mentioned will be benefited. Setup services and the training of the surgeons are not that very expensive. If we look at the cost per unit of surgery, then you will see that the cost will be effective if it is done in a private basis, even now. Why it will be effective and useful and cost effective, I will tell you in the last slide. Please wait for that. Surgical robots market is expanded, huge. You can see these are the companies in the US. they are being trying, and all US and Europe. Particularly the intuitive surgical has got the largest market, but they are going to face huge competition. On the left-hand side, you can see the Chinese robot are in the market. On the right-hand side, the Da Vinci system, which was who actually popularized this device, and for the last 20 years, they are dominating in the whole world market, now facing extraordinary competition. CMR Vertius on the left-hand side. On the right-hand side, you can see the Japanese Hinotori system. They found to be very useful, and the cost has been reduced to a great extent. The Hugo Ras system is a Medtronic device, which we are trying to buy it. Maybe it is becoming more expensive. It's about $2 million, but the net cost, but the establishment will cost another $2 million or something like that. That is one of the issues that the government or the university authority is thinking and rethinking. I hope they will be able to make a negotiation and this will come down. India has developed the surgical robot, which is quite useful. This meeting should have been accompanied by the one of my friend, who is the director of the Rajiv Gandhi Cancer Research Institute. Vinit Talwar is here. He was expected to come, but he declined because of some other important commitment. He wanted to give this talk in the form of a debate. I was also requested to participate in the debate, but however, it has been converted into this whole lecture. However, he is using this mantra. And with a personal communication, he stated that mantra is quite good. They are equally effective as original Da Vinci classical equipment. So you understand, as this Asian country is invading into the world market of the robotic system manufacturing, I'm sure that the price will come down to half or even less. Maybe I will not be very surprised if Bangladesh engages himself to manufacture the surgical robot. These are equipment only, nothing more than that. We can go for assembling. We can export it to the other parts of the world. I'm optimistic to that extent. Necessity for the surgical robotic technology is very important. Why we need it? We need precision surgery. That's why we need precision equipment. Da Vinci's surgical equipment may be very expensive, but Chinese robotic system or the Indian robotic system is not going to be very expensive. We will be able to buy it. And people already know this fact. As a result, huge impact has been created over us. Every day we are just in interview with the patient used to ask how we will do this proposed surgery. Is it laparoscopy or some other? We have learned that the robot is extraordinary. Do you have robot? So naturally we had to decline. So people already knows it. And these are the demands. So surgical robot can enable the complex and precise procedures which may not be possible by traditional methods. This information is known to the people. So there is a people's demand. When the peoples need it and demand it, it will be available very soon. Human robotic prostatectomy and the robotic prostatectomy in high volume academic centers. This is a very good paper which clearly outlined that all the aspects are almost similar, but precision built surgery and the blood loss is very, very less right at this time. But I am sure that over the time they will improve further and further. So we cannot lag behind, we need it. Luxury, yes, it's not luxury. Cost management, etc., they are expensive, but these equipments will provide constant benefit to our populations, those who will need it. Human resources, these are the challenging issues. We may develop it. Developing countries should have shortage of skilled manpower. Right at this time, if we buy robot, then before that we need to create our manpower. So good laparoscopic skill, good traditional surgery is very important. If we can do that, then we will be shifting or transforming in our work into robotic works very easily. So what we can do, what the developing country can do. Immediate cost may be high, but with time, the cost will come down. The intermediate technology like laparoscopy should be heavily emphasized and should be performed appropriately. More laparoscopy will lower the demand of the robotic surgery. 3D laparoscopy is almost equivalent to robotic surgery. That may be made available. It's not very expensive. That costs about 1 crore taka only. So 5G internet technology has to be organized, and that will bridge the people in the remote area by the telesurgery, and possibly they will reduce the gap. They can manufacture their own robotic system. Robotic surgery is not going to disappear. They will continue to grow. They will continue to miniaturize. They will continue to have more refinements. So the size, cost, and the function will improve very fast. The multiple manufacturer will produce the surgical robotic system. Then competitive market will bring the cost down. And focus for the training program is very important. At the end of the century, the robotic became the norms of surgery. Not the open surgery remains the norms of surgery. Any surgery means robotic surgery. In the last month, I was in Singapore for a congress, and my friends I asked about their robotic use. They said that all my patients understand that anything done will be done by robot. So that happens in Asian countries. That is going to happen in India as well. So why not we? So surgical robots can offer significant advantages from simplex to complex in the complex procedures and improve surgical outcome. Government sponsorship of robotic program is very much important and may be the game changer. I was invited in 2004 in All India Medical Institute when they have purchased their first robot. So in that particular meeting, Moni Menon came there. Moni Menon was one of the inventor and the very important consultant who has converted the robotic technology from the industrial robotic technology. He has converted into the medical technology, useful for the medical device. So he came. So this machine was brought by government. In Pakistan, what happened? In the Sindh Institute of Urology and Transplantation in Karachi, okay, I'll be finishing in 2 minutes' time. Okay. In Karachi, the government has given a machine. And Sindh Institute of Technology, they said, for the next 2 years, all the cost will be, treatment for cost will be borne by the patient, by the government. As it happens, it will create huge number of robotic surgeons. And then in the private sector, it will be very quickly, they will buy the machine and they will start the operation. So that is one of the way to go. Factors such as cost of the healthcare infrastructures, human resources should be taken into consideration. And if we can do it and if we can regulate it, I'm sure that this will bring our dream into true. Our GDP is improving, but we should be careful to conserve the money in the developing nation. Having said that, I would like to stop here, and I dream that in a short length of time, we'll be blessed with robotic technology, at least in the university hospital and important private sectors. Thank you, sir, for the opportunity.